I see patients and I do research. And so about 75% of my time is dedicated to research activities, studying mechanisms that give rise to genetic mutations associated with leukemias and lymphomas. And the remainder of my time is dedicated to patient care, which involves primarily taking care of patients who are admitted to the hospital with various blood disorders, specifically leukemias and lymphomas. Having leukemia or getting a diagnosis of leukemia can be very devastating to somebody. And there's support groups in place there, but the thing that we recommend the most is discussing it with family and friends. Other than that, it's a long haul. A lot of cancers, when you first get the diagnosis, for example, breast cancer, that's a disease that you treat as an outpatient. And you come into clinic, you get your chemotherapy, and you go home. Someone who has acute leukemia, it's a long haul. It's a very different process than being treated for a solid tumor, because these patients often, at the beginning stages of their disease, they're admitted to the hospital and they have to stay in the hospital for a month, sometimes 2 months at a time, while they're getting their treatments. So from that standpoint, it can be very mind-numbing, so to speak, and very depressing. And we encourage people to keep busy. We encourage people to keep mobile and keep active. Within the hospital here at Yale, we built a healing garden on the 7th floor of Yale Cancer Center to allow people to give people a place to go and decompress and be outdoors while they're undergoing their treatments. But otherwise, it can be a very difficult process. You know, I mean, some patients are you'd be surprised, a lot of patients are very positive. A lot of patients, after they get the diagnosis, initially there's that phase of they're just stunned and they can't believe it, but at the same time they recognize that something is wrong because they've been feeling sick for months coming up to this point, or weeks getting up to this point. And then the next phase typically is anger. Sometimes they argue with their physicians and nurses. Other patients are very accepting of it and say, okay, I'm going to fight it. And they just sit back and let us do our job. And they tend to do very well. We try to keep people's spirits up, saying there's not much to do except to keep eating well and keep active, and let the chemotherapy take effect.